Alfie here at Vente Pain Relief Clinic, and today I want to talk a little bit about pain in the hip, particularly around the upper hip area, upper thigh, and also pain that goes down into the knee. Now, I'm asking if you're encountering that right now. There's probably a link between the two, the hip pain and also the knee pain, particularly on the outside. And that link is a muscle called Tensor Fascia Latae. Tensor Fascia Latae, as you can see here from scaling, this is a little model that I've kind of taped up so that you get an idea where this muscle runs. So Tensor Fascia Latae runs where the area called the iliac crest, the top of the iliac crest here, and you see this red tape. It runs down sort of the outside front of the upper thigh and basically blends into this whitening here. You can see the white tape. This is the iliotibial band or iliotibial tract, this white thing here. So you see the red, that's the muscle, and this is basically the blending into the iliotibial band or the iliotibial tract. You may have heard friends that are runners that have had problems with the iliotibial band. It can be annoying. In this case, we're going to talk a little bit about the hip pain in relation to the knee pain. So when this muscle becomes very tight, what it does is it basically can cause pain into the top of the thigh here. What this muscle does is basically it brings your knees up towards your chest. It does something called hip flexion. It also turns your leg inwards. It's called medial rotation, and also brings your thigh outwards. So when you're doing something excessive, such as like bending your knees when you're sitting, usually people who have problems with tensor fascia latae muscles, I found that a common theme for the most part is they sleep on the side and they basically bring the problematic leg or thigh over the opposite leg. So they're sleeping in this position here where they're bringing this leg over and crossing it over. This muscle becomes very, very short. Over time, it can cause problems in the hip. So you compound that with activities such as running, or maybe they're doing too much of it, sitting for prolonged periods, maybe they're doing things such as a lot of squats, a lot of lunges in the gym. It can cause this muscle to become very, very tight. And a clue that you may have a tensor fascia latae problem is the pain that you feel around the upper thigh, upper outside thigh, and into the knee. And the reason why this happens is because when the tensor fascia latae becomes very, very tight and short, what it does is it pulls on the IT band. It basically pulls on the IT band, that thickening of tissue, of tendinous tissue on the side of the thigh. And when that happens, it can cause irritation to where the IT band attaches, which is on the outside part of your shin bone or your tibia bone, and it can cause irritation around the side of the knee. So there's the link between the two. So if you're encountering this, that might be the reason why you're getting both the upper thigh and also the knee pain. I just thought I wanted to pass that message on to you so you get an understanding that it could potentially be this muscle, tensor fascia latae. If you've got questions, feel free to call us at 416-644-8894 or email us at admin@ventepainrelief.ca. I will be having videos every once in a while, at least once a week, regarding issues such as tensor fascia latae or other muscular type of issues or other conditions for your own knowledge. Anyways, have yourself a great day. Take care. This is Alfie again at Vente Pain Relief Clinic.